You're doing everything right. You're eating well, you're trying supplements, you're exercising as best you can, depending upon how sick you are. You're seeing doctor after doctor, but you're still exhausted, feel inflamed, or in pain. Are we missing something in the biology? Are there therapies that can actually change the trajectory? Therapeutic Plasma Exchange has become one of those answers. Hi, I'm Dr. Gary Kaplan, founder and medical director of the Kaplan Center for Integrative Medicine here in McLean, Virginia. Today, we're going to talk about Therapeutic Plasma Exchange, who's it for, how it works, and why it's expanding beyond the hospitals and the ICUs to treatment for patients struggling not only with chronic illness, but also in longevity care. Have you ever felt like your body is fighting a war that you didn't start? You're doing everything right. You're eating well, you're trying supplements, you're exercising as best you can, depending upon how sick you are. You're seeing doctor after doctor, but you're still exhausted, feel inflamed, or in pain. For decades, there has been a powerful treatment used in hospital ICUs for life-threatening conditions. And now that same treatment is starting to help patients with long COVID, fibromyalgia, Alzheimer's, chronic Lyme disease. Before we dive into the science, I want to share with you why this is so personal to me. As a physician, I've spent years treating patients with chronic illness, people who are clearly suffering but don't always fit neatly into traditional diagnoses. Worse is, we'll frequently give people a diagnosis such as ME/CSF and fibromyalgia or post-COVID, and then call it a day because we don't know what to do next. The fact is, there's a great deal that can be done, and there's a great deal we now understand about these diseases. Unfortunately, many physicians don't know that. So this has led me to look a lot deeper to explore more therapies that address root causes. Therapeutic Plasma Exchange has become one of those therapies. I've even chosen to undergo the therapy myself. More importantly, however, has been my wife's journey with Alzheimer's. So we've treated a number of patients, and we've just started doing this procedure this year. I'll tell you, the one I'm most gratified about is my wife. My wife had horrible side effects from the anti-amyloid drugs that were being used to treat her Alzheimer's disease. She developed brain swelling and some hemorrhage in her brain and had to stop those procedures. We stepped in and put her on Therapeutic Plasma Exchange with a dramatic improvement in her condition. She's now beating me in card games that she was previously consistently losing to me on. But the reality of the matter is I couldn't be more delighted to see how much better she's doing. This has created an urgency in my thinking about this because there are studies demonstrating that Therapeutic Plasma Exchange can improve the cognition of these individuals and slow the disease by as much as 50 to 60%. Are we missing something in the biology? Are there therapies that can actually change the trajectory? Therapeutic Plasma Exchange has become one of those answers. Therapeutic Plasma Exchange is a medical procedure. It removes part of your blood plasma and replaces it with clean fluid. Here's a simple way to understand it. Think of the body like a fish tank. Over time, waste builds up in the water. Even if you're feeding your fish perfectly, if you don't change the water, the fish gets sick. Therapeutic Plasma Exchange is like changing the water. It removes harmful substances from the bloodstream, replaces them with a clean solution, albumin, and typically mixed in a saline solution. During a session, blood is withdrawn through an IV. A medical device, much the same as the ones used in the hospital, separates the plasma from the blood cells. The plasma is removed and then replaced with clean, sterile fluid. Your blood is then returned to your body. Each session lasts about 2.5 to 3.5 hours, and you're monitored the entire time by trained medical staff. So what exactly are we removing? Therapeutic Plasma Exchange removes specific substances from the blood, including autoantibodies that can attack your own tissues, inflammatory proteins called cytokines, and immune complexes. These are often key drivers of chronic inflammation and immune dysfunction. Therapeutic Plasma Exchange helps interrupt that cycle. Life can get a bit confusing because in medicine, we frequently refer to the same procedure by several different names. So therapeutic plasma exchange can sometimes be referred to as apheresis or therapeutic plasmapheresis. All of these mean the same thing, same procedure. This is not experimental. Plasma exchange has been used for decades in conditions like Guillain-Barré syndrome and myasthenia gravis. What's new is that we're applying it to fight chronic illness and aging. Let's talk about how this therapy has become more accessible. Historically, therapeutic plasma exchange was limited to hospitals and ICU settings. That's because it requires specialized equipment and close monitoring. But with the advances in technology and protocols, therapeutic plasma exchange can now be safely performed in outpatient settings for carefully selected patients. At the Kaplan Center, we've worked closely with pioneers in the field specifically to bring this therapy into an outpatient model. We are currently the first and only outpatient location offering therapeutic plasma exchange in the Washington, D.C. area. So let's talk about who the therapy is for. There are two main groups of patients who may benefit. These include those suffering with chronic illness like long COVID, chronic Lyme disease, fibromyalgia, PANS, ME/CSF. In many cases, these conditions, harmful antibodies and inflammatory signals are circulating in the blood. Therapeutic plasma exchange helps by physically removing those factors. Now, let's connect this to many people struggling with other chronic illnesses such as fibromyalgia. Fibromyalgia is often misunderstood. It's a generalized pain phenomenon. But research shows that patients can have measurable difference in inflammatory signaling and immune activity in fibromyalgia. There's also evidence that cytokines, these inflammatory messengers, may play a role in symptom severity. So again, we come back to the same idea. Something in the blood may be contributing to the symptoms. Now, we don't yet have large clinical studies of therapeutic plasma exchange specifically for fibro, but in related conditions like myalgic encephalomyelitis chronic fatigue syndrome, early studies suggest that removing certain immune factors followed by immune support can improve quality of life in some patients. Indeed, a study was just published in one of the European journals showing very significant issues with autoimmunity and ME/CSF, as well as post-COVID syndrome. So while we can't say that therapeutic plasma exchange is a proven treatment for these conditions, there is strong biologic rationale that supports further research. Now let's shift to something that's getting a lot of attention: longevity and biologic aging. When we talk about aging in medicine, we're not just talking about how someone looks. We're talking about biologic age, how the body is functioning internally. And biologic age can be different from chronologic age. So the big question is, can we actually influence biologic aging? We're starting to see early but real human data suggesting we can. The other thing I want to tell you about therapeutic plasma exchange, which is somewhat maddening, is that the majority of physicians out there have no idea whatsoever that can be done in the outpatient setting. They think of it only in context of ICUs and hospitals. And what's particularly aggravating about this is when I turned to my wife's neurologist and said to him, how about therapeutic plasma exchange? He told me, an expert in Alzheimer's disease, that he had never heard of it being used for this. This despite the fact that there were several large studies published within the last year on therapeutic plasma exchange treating Alzheimer's. I brought him those papers and he said, well, we'll have to see. I run into this all the time with physicians. They don't know about it being able to be done in the outpatient setting. They don't understand how safe it is. And as such, they don't offer it to you as an option. So you're going to have to do your homework. And don't be surprised if your physician pushes back and say, it's not safe. That's not true. There are plenty of studies demonstrating at this point that it is. And our experience shows that it is indeed safe and it is indeed effective. Unquestionably, therapeutic plasma exchange is going to become more widespread. It works. It's being effective for people who have otherwise not been able to find solutions for their problems despite multiple other therapies. Is it a cure-all in and of itself? Probably not. But it is an important adjunct therapy to people who are struggling with these diseases. Yes. And we're seeing improvement. So the bottom line is this is a new therapy to most of the profession, but an old therapy that's been around for quite some time in the hospitals. Its newness is about being used in the outpatient setting, making it available to more and more people. So this is particularly exciting. Our job at the Kaplan Center is to keep on the cutting edge, to keep getting better answers for you, And this is one of the therapies we found that has made a very significant difference in the lives of a number of our patients. Therapeutic plasma exchange is not a cure, but it can be a powerful tool to reduce disease burden, improve function, especially when it's used as part of a comprehensive treatment plan. So let's talk about what patients can expect when doing therapeutic plasma exchange. Each session lasts about 2.5 to 3.5 hours. You're monitored closely throughout by a nurse who's specially trained in administering therapeutic plasma exchange. Treatment frequency is individualized. Some patients start weekly, others every 2 weeks or monthly. It depends on the condition and the response. After treatment, some people may feel more clear-headed, less inflamed, more energetic. Others may feel temporarily fatigued. Indeed, myself, I was very tired, surprisingly enough, for about a day afterwards, and then felt dramatically better. So risks are generally low, but can include low blood pressure, electrolyte changes, fatigue, and sometimes IV-related complications such as bruising at the site or some bleeding. Cost is also an important consideration. Typically in the hospital setting, therapeutic plasma exchange is already approved for a number of conditions, such as Guillain-Barré that I mentioned earlier, and myasthenia gravis, but it's not approved generally in the outpatient setting. So costs are variable and coverage is variable with regards to the therapy. Here's the big picture. Therapeutic plasma exchange isn't new, but how we're using it is evolving, and we're finding its applicability in more and more conditions, getting better results for our patients. We're moving from emergency intervention, such as the ICU, to earlier treatment for chronic illness, and even exploring its role in longevity and brain health. For patients who feel stuck or out of options, this offers a different approach, one that focuses on changing the internal environment of the body. So if you like our content, please give us a like and subscribe to the channel. I want to be able to give you as much information as I can in order to help you find a solution to your problems or the problems of your loved ones. If you're curious, ask questions, do your research, and talk with a qualified provider. Thank you for your attention. I'll look forward to seeing you in the next episode.